The government was criticised as being slow to act in bringing in lockdown measures earlier this year. And right now we're 48 hours from restrictions easing further. At the same time, we have several countries like Germany, Sweden and France, which are showing signs of a second wave of cases. And worryingly, we have the new lockdown in Leicester. Now, the Mayor on Tuesday sensibly asked for clarity from the government on local lockdown powers for our city. Now, I understand that London doesn't currently have powers to bring in our own lockdown, even if community transmission rises. So if the government responds positively to the Mayor's request, are you ready from an organisational point of view for a London-specific second lockdown if it's required?
I think that's a very interesting and good question given the circumstances and what's been happening in Leicester. I think it's fair to say that given the local lockdown plans were published yesterday, there is a degree of work taking place with Public Health England and colleagues, as I mentioned before, with the Met, to exercise through different scenarios in London. London, by definition, is far more complex and I was going to call it difficult, actually, but the landscape and the governance landscape in London is somewhat different to Leicester's, which means that we do have to work on the basis of cooperation across borders. It's fair to say as well that a number of colleagues, particularly in local authorities around the directors of public health, have experience in epidemiology and dealing with outbreak and case management, for example. The scale of COVID could be different, I would say could be different, and may require a different level of intervention. Whilst we may not have local powers within London to deal with this, there are powers under the Public Health Act for DPHs, Directors of Public Health, to take intervention. And clearly the reason why the Transition Board, the Transition Group and the SCG are still in existence is exactly to raise these coordination issues, both to the Mayor, to the Assembly and to government as well.
And is there anything that you would change in your preparation for a second peak compared to what happened in the first wave that began in March?
I think there are an awful lot of lessons that have been learned, particularly around forecasting and planning about what the pandemic may look like in London. It has to be said, though, that the knowledge of how coronavirus affects individual communities is still being understood and is still being worked on. The data is still being worked through in terms of its impact across London and the measures that can be taken to impact it. So we have already had a learning exercise and debriefed various agencies on the initial stages of lessons to be learned. Those have been incorporated into our operating procedures and processes. They will undoubtedly be different, and I won't say, I would not give you 100 degree of confidence if I can say that, Assembly Member. We will continue to learn because this is a very different kind of, as I say, incident that we're used to dealing with, and it does require fleet of footness by all agencies, including the private sector, to be able to reduce the risk to Londoners and get London back, frankly, functioning again.
Thank you. I'm actually going to sort of pick up on the need for fleet of footness with Fiona with some questions about data. So this next question is for Fiona Twycross. Fiona, we're getting frustratingly little data on cases from the government, which presumably is restricting our ability to help Londoners and also Londoners' ability to make safe decisions. Now, I understand that just the Pillar 1 data, which is the results from the swab testing in hospitals and care homes, and some postcode data has been available, while the community transmission data, the Pillar 2 data that led to the Leicester lockdown, has not been made widely available. Now, there have been reports of other authorities with worrying levels of community transmission, which are showing in the Pillar 2 data. Have you asked government for this data to be shared publicly, and are you confident that you have sufficient access to all the data you need, including Pillar 2 data, to help the SCG to take the strategic decisions required to keep Londoners safe?
That's a very long question and covers a huge amount of ground. What I would say is that data is clearly very important. We've been blessed, and this might be something actually that is more appropriate for John Barradell to answer. And I think I was pleased that people thanked him and others for their work during the pandemic so far. We really do owe John and Eleanor as his co-chair, Eleanor Kelly as his co-chair, a huge debt of gratitude. In terms of the data, I think there is actually quite a lot of data out there. It's about making sure that people have access to data they can understand, both that are, and it's shared as appropriate, both within the SCG context and also publicly. If you look at what happened this week, there's been loads of scare stories about what might happen in London based on an insufficient understanding of what R rates mean, of what data is out there. So I think it's about sort of making sure that we get clarity of messaging about what data there is means for local areas as much as it is about data. To be honest, I think there is quite a lot of data. We do need to make sure that the right partners get the right level of data at appropriate time. However, I think this is something we'll continue to ask for, and it's part of that sort of emerging understanding of how we will manage the pandemic going forward.
So just to be absolutely clear, have you had the Pillar 2 data, the care home data? Have you had access to that? Not the care home data, sorry, the community transmission data. Have you had access to that in London?
I'm looking to John to see whether he thinks we've got sufficient on that. I think I've seen a reasonable amount of data on that, but obviously it depends on what's reported. In terms of the needing to have access to timely data, I think the Mayor has requested this from the Secretary of State. It clearly is going to be important going forward. But I'll hand back to John to clarify whether he thinks we've had enough data on care homes as we've gone through, and apologies for not being clear on that myself.
No, sorry, just to be clear, it's the community transmission data, the Pillar 2 data, that I'm just wanting to check that you've had access to. But if John could answer, that would be great.
I think this is what the Mayor has asked the Secretary of State, I think in a letter that's gone just this week, in terms of making sure we have that data in a timely fashion so that the SCG, the Transition Management Group, when it sort of morphs into that, and other partners have that information so that we can make those judgments and plan appropriately.
Thank you. I'm sorry, I'm completely out of time.